Well, I want to welcome everyone for coming out on this beautiful day here in Hubbardston, Massachusetts, to our home. I'm Mike Muchler and my wife Shelley Parker, and we've been living at our house here for 25 years, and been delighted to be a part of the project that RCAP Solutions is being a part of, and I want to welcome and thank you, Jan, for inviting me. I've known Jan for many years in the work that I had with the Health Foundation Central Mass, and when she said if I'd be willing to help out, I said absolutely. So I'm certainly very happy to have everybody here, and for our guests and our speakers as well, and have learned a lot so far. In having our tour of our house, learning things about that. But from the folks here at RCAP Solutions who will be talking, thank you for coming, from the Health Foundation Central Mass, and certainly very happy to have Senator Goby here, who's, I don't think we've ever had a politician in our lawn, so which is actually very nice, very good.
Don't worry, I'll leave.
And we also, and we are being represented by Congressman McGovern here, by a lot of you, who's with us here, and so thank you very much, and I look forward to hearing from the speakers, and thank goodness that Mother Nature allowed us to have this day here today.
Thank you.
Okay.
Thank you.
Thank you. Yeah, I just want to add my gratitude to all of you for doing this. We are very happy to have this evaluation done, and as family doctors, we know the importance of health and our healthy water. It's an easy thing to take for granted, and we've learned a lot today, even though we are somewhat knowledgeable, but not knowledgeable about the technical aspects that are important to ensure that we have healthy water. So we really appreciate this opportunity to learn ourselves and hope that other people will take advantage of this program to find out themselves and be healthier. So thank you very much.
Thank you.
Good afternoon, everybody. My name is Brian Scales. I'm the Executive Vice President at RCAP Solutions, and I'm also this project's director. And I'd like to welcome you all here and graciously thank our hosts again for having us here. This is a long time coming, and so to speak, because we wanted to start this off last year, but because of the pandemic, we pushed it off a year. We are now in our pilot year. We have 6 towns that we will be working with, and Hubbardston and Boxborough, which we were at earlier this week, are our first 2 towns. So we're very grateful that you allowed us to your home and be able to participate in this very important project. And I just want to recognize some of the folks out here, as Dr. Muchler also said. Karen Kohler, our President and CEO of RCAP Solutions. Dr. Jan Yost, of course, from the Central Mass Health Foundation. My good friend, Senator Ann Goby. And my other good friend, Eladia Romero, from Congressman McGovern's office. And I think that we will get started here. We have a short speaking presentation, so I'd ask Dr. Yost to come up and give a few words. Thank you.
When you hear of Flint, Michigan, what comes to mind? No doubt it is the catastrophic failure of the city and the state to provide residents with safe drinking water. Flint was once a thriving city, the birthplace of General Motors and other industries that were allowed to contaminate the Flint River. Then when GM struggled in the 1980s, many jobs were lost, half of the city's population left, and 1 in 6 homes were left abandoned. With the tax base eroded, Flint was operating with a deficit. And as a cost-saving measure, the decision was made to discontinue a 50-year practice of piping in clean water from Detroit. Instead, contaminated water was pumped from the Flint River, while a new pipeline from Lake Huron was being built. The corrosive Flint River water caused the aging pipes to leach lead into the homes. Elevated lead in blood levels of Flint's children nearly doubled, and in some neighborhoods nearly tripled. Flint pediatrician Dr. Mona Hatta Adisha, who collected the evidence, emphasized lead is one of the most damning things you can do to a child in their entire life trajectory. Perhaps we cannot imagine such a horrific development in such a bucolic environment in New England, here in Hubbardston, where families draw their water from their private wells. Perhaps some believe that God created earth and it came with clean water to be drawn from private wells forever. But Massachusetts, too, has its share of stories of damage that mankind and industrial development has done to our environment. To protect the public health of our communities without municipal water systems, we have a responsibility to assure that private wells are a safe source of water. There are more than 90,000 private wells providing drinking water to residents in central Massachusetts. Rather than trust that the well water is safe, we need to verify that it is. Thus, the Health Foundation is pleased to support the effort led by RCAP Solutions to develop a private well program in partnership with local boards of health, the Massachusetts Department of Environmental Protection, the Massachusetts Environmental Health Association, the Massachusetts Public Health Network, and the Neshoba Associated Boards of Health. The foundation provided $204,000 to pull the partners together in 2000 to plan the program. And for this year, we have awarded an additional $425,000 to pilot the program with 40 households. As the program further develops and is implemented over the next several years, we anticipate that the Commonwealth will establish regulations requiring routine testing of private well water and a support mechanism for remediation of contaminated wells. We thank RCAP and its partners for taking on this project to assure our residents have access to clean, safe water. And we especially thank you all.
Me? Thank you. We look like we're twins today. So, as I was saying to Senator Goby a few minutes ago, this is like my old territory. Many of you know that I was involved with the Greater Gardner Chamber of Commerce, which covers Hubbardston many years ago. But one of my fondest memories is with your predecessor, Steve Brewer, who oftentimes attended our chamber events, but one of his classics, and if you didn't know Senator Brewer, he's alive and well and doing well, thank God, but he was a piece of work, that guy. And so he came to Hubbardston House, which is not too far from here, which we created, Hubbardston House. And he was there many years ago, and I had a pair of what you might call jazzy sunglasses on. So he takes them off, he puts them on, and he says, "Let's rock." And he had such a good time with all the seniors at Hubbardston House. And I am just, many years ago, we also had an anniversary celebration for rural housing improvement, and which was our prior name to RCAP Solutions. And he came and he said, "You are truly doing God's work." And when I drove out here today, there is nowhere else that I would rather be than in North Central Massachusetts on such a glorious day. And I just have wonderful memories of him. So I'll get back on track. So as I said, we have RHI, which was our original name, Rural Housing Improvement. We were a part of the Massachusetts Opportunity Council, and we ended up splitting away in 1969. And so we've been in North Central Mass for, 53 years now. During that period of time, our early years, we were primarily only housing. And so in this region, you have over 500 self-help homes that were created by RHI. You have over 400 senior level standalone housing places, such as Hubbardston House, which are all HUD 202s. That's a form of funding which comes through the Housing of Urban Development. And so we're not foreign strangers to Hubbardston. But what we are, I want to talk to you about the water piece, and I thank you, Jan, so much for the intro about Michigan, Flint, Michigan, and we got into the water business, if you will, during the Jimmy Carter administration. Jimmy was the person, listen to me, I'm talking to him like he's my best friend.
President Carter, who's close to 100 years old. This is important to remember that this program came from him. And so I feel like I'm his advocate, I don't know. But President Carter, as many of you know, ran on a rural base. And so he was from Georgia, rural Georgia, peanut farmer. And so when he won the presidency, he had to make good on his promises that one thing he said is, I want to make rural America something that people understand and talk about. And so he asked his delegates to find out who's out there doing rural. And it just happened that rural housing improvement came up on the list. And my predecessor, Ernie Baresh, God bless his soul, was at the meeting where the RCAPs were born. And that was back in the Carter administration. Since then, we've been what I call underground. Water's underground. Oftentimes, we don't think about fresh drinking water or solid waste or any of those kinds of things until you have a pipe burst or you have like the horrendous issues in Michigan. But it's there, and it is now, to the credit of the administration, being talked about again. And we believe that this is just a very small beginning of what will become a rural advancement activity where many people who live in beautiful communities like this need to have more assistance, and we need to provide it. And that's what RCAP Solutions does each and every day. I want to thank the Health Foundation for your having the trust in us. And Jim, our steward of the project, you're not the back guy, you're the front guy. So Jim has been with us for a number of years. He is a technician. He's our state lead for Massachusetts. And I think that it's important that you speak a little bit about the program as well. But thank you so very much, especially to the doctors and anyone else out there. But most importantly to all of you for this opportunity to revisit God's earth, as Senator Brewer would say, and do God's work. So thank you very much. And I think, Jim, you're next. Thank you.
Hi, good afternoon. I'm Jim Stiles, Massachusetts State Lead. Just want to talk a little bit about the state law. It kind of brought us to this program, if you will. Unlike other health codes that local health departments regulate, septic code, Title V, your food code, swimming pools, private wells do not have a state minimum code. There's a model regulation that's put out by Massachusetts Department of Environmental Protection that they hope that boards of health will adopt, but it's not regulated or mandated that they do. And they also can be less stringent than those regulations that are put out by, those model regulations that are put out by Mass DEP. So it leaves private well owners really on their own. There's no water operator making sure that their water is running right. There's no testing being done at least monthly. There's no Mass DEP oversight making sure everything's done right. It's totally on the homeowner to take the initiative to test and really be in the know. It's a consumer protection issue as well. It's just another check the box when you buy a home. Would you like a lead test? No. Radon test? No. Well test? No. Unlike a septic system that must be inspected and certified by an inspector, which doesn't really make much sense considering we're actually drinking water from a private well. So I want a little bit on the program. What we're doing for a well assessment program is really about education for the homeowner. Prior to meeting with the homeowner, we do a records check for the state as well as the local board of health to see what kind of records we can find, get some background information. Then we meet with the homeowner, ask quite a number of questions about what they have, concerns they might have with their well, talk it out with them, do a site inspection of the well itself, the septic area, talk about any treatment they might have and how it's been run and how it's being maintained. And in 2 to 3 weeks after with the sample results come back from the lab, we'll be sending the homeowners a full report with everything we discussed, as well as the sample results, and if there is any problems, tip sheets and other things to help the homeowner through that, as well as follow-up technical assistance if anything is needed after the report. So that's really what the program's looking to do, is really about education and change really in the Commonwealth, and hopefully at the end of this, we'll be able to make a change throughout the whole state and make a minimum standard for a private well that local boards of health can be more stringent. They do have that authority, but at least we'll have a minimum standard that every town will be going by. Thank you.
Thanks, Jim. And I'd just like to offer Senator Goby to come up and spend a few words.
I'm no Steve Brewer, but you're right. He would have said you're in God's country here. He absolutely would have said. And thank you again for allowing us to come here. But I also enjoyed the history lesson on that. Being a former history teacher, I don't think I knew the whole little bit about with President Carter in there and the role that he played. But thank you, Karen. Thank you, Brian, for the work that you do. RCAP has worked for years just improving the quality of life. And I know that this is probably your first interaction with them, but I can tell you for the numerous phone calls I make to poor Brian's office, especially for housing issues or for guidance, they're the go-to organization for our area. And I'm not just saying that because he's standing there. It's the absolute truth. It's the absolute truth of what they do to help other people. And Dr. Yost, whose name is synonymous with public health. So it came, when I saw the agenda, I said, well, of course she'd be involved. Because there's no way, her leadership on so many issues that have helped. And I want to thank you, too, for the work that you've done with my boards of health and the boards of health across the state, because it does make a difference. And Jim, it sounds like you're advocating for new legislation. I got to start writing stuff down, I think, on the way back. But, thinking about it, Ladia, with the work that's done on the federal level, of course, Massachusetts, our Clean Water Act was based on the Fed's Clean Water Act. This area specifically, because of the watershed protections, because of the water going to Boston, I think people in this area have a much deeper appreciation for what's under the ground, like you said, for the water. And one of a predecessor of Steve Brewer and I was Bob Wetmore, who has passed along. But it was Senator Wetmore's work that Article 97 of our state constitution that says everybody in Massachusetts has the right to clean water. It doesn't say everybody that's on a private system, or a public system has it, but everybody has the right to it. So it's absolutely incumbent upon all of us to do what we can. And if it means some stricter laws to make sure that happens, so as the doctor said, you should be able to turn on your tap and not worry about carcinogens coming out, right? I mean, it's pretty basic. And it's a basic right of human life to have clean air, clean water. And so thank you, and I promise to do my part to make that happen. But I appreciate you allowing us to be here today. And so even though this was the first time that you had a politician, hopefully it won't be the last. I might be back. Right around election time. Okay. But thank you. Thank you.
So that concludes the speaking portion of this. I'd like to thank everybody again, especially our hosts, for inviting us out here on this great day. Everybody enjoy your weekend and get a chance maybe to drive around Hubbardston and get a little taste of it. So thank you all for coming.
Thank you very much.
For more information or to request a well assessment, please visit our website.